Thank you for joining us tonight. We are broadcasting via Zoom and Facebook Live, the fourth of the PCHC quarterly community conversations. We're really excited to have a great lineup tonight to talk about food insecurity and hunger in Maine, as well as the benefits and importance of good nutrition, particularly for certain populations, for example, school children, the elderly, just in terms of keeping people healthy, which is what we do at PCHC. This is also part of a weeks-long program that we're running at PCHC called Healthy Harvest. And through Healthy Harvest, we're hoping to draw awareness and to educate folks around the idea that not all of our neighbors in Maine get enough to eat. And that's neighbors from little tiny children to extremely elderly people who might live down the road from you. So it is a problem in Maine as it is in every other state in the United States. And it's especially a problem that goes a little bit under the radar in rural states, because Maine is an agricultural state and we are just blessed with an incredible bounty of farm produce and fisheries, and there's an incredible hunting culture in Maine. Many people hunt to feed their families over the winter. Because of the incredible bounty of the land, we often don't recognize that there are people who still don't have enough to eat. So that's kind of what we're going to be talking about tonight. And I'm happy to be joined by a representative from Good Shepherd Food Bank, which runs the largest network in the state to distribute food to folks in need. Dr. Megan Mamula, who is the medical director of Brewer Medical Center, which is operated by PCHC, and a family practitioner, and she sees many patients, and I think she'll bring great perspective. And Anthony Pilat from the State Office of Family Independence, and he's here to talk a little bit about some of the government programs that address hunger. But I'm going to actually ask them all to introduce themselves to you and maybe tell you a little bit about their experience with working with programs that address hunger. So Dr. Mamula, would you like to start?
Sure. Hi, I'm Megan Mamula. I'm the medical director at Brewer Medical Center and a family physician. PCHC was actually my first job out of my residency 21 years ago. And I grew up in Orono. I have had the good fortune of working with PCHC. I think that one of our strengths is being able to identify social determinants of health, such as food insecurity. It is an important area to identify off the bat, and I'm not sure that we always do a great job screening for it. It does reflect on our patients' ability to have longevity of life and be healthy.
Great. Dawn?
Good evening, everybody. My name is Dawn DiFiore, and I am with Good Shepherd Food Bank. I'm the Director of Community Partnerships there. I've been with the Food Bank for just about 3 years, so it's been an exciting ride from pre-pandemic times to living in a normal state of crisis, kind of where we are right now. I'm happy to be here tonight and answer any questions and just to take part of the panel. So thank you so much, Kate, for having me. I appreciate it.
Great. I'm looking forward to hearing more from you. Tony?
Good evening. My name's Anthony Pilat. I'm director at Office for Family Independence. I have over 26 years in health and human services, almost all of it with family independence. I've had most of the jobs in the office, from clerical to eligibility specialist to now currently the director. Very happy to be here tonight and look forward to the discussion. Thank you.
Great, wonderful. And I'm Kate Carlisle. I'm the Director of Mission Engagement at PCHC. And the best part of my job is getting to connect with folks in the community and at the state level, the local level, who are doing this great work for Mainers and for all people. So those are the introductions. I'm gonna just ask Chris to share his screen for a second to show you a slide about food insecurity in Maine that it was kind of surprising to me. So this is a map that is from an organization called Feeding America. And it's a wonderful map on their website if you ever want to go there. It breaks things down by county in every state in the United States. And here, what we're looking at is food insecurity, specifically in the communities that PCHC serves. And you'll see that the food insecurity rate is fairly high in Penobscot County, which is one of the few counties in Maine that is not considered a rural county. It's a little bit lower in Waldo County, which is a rural county, and it's pretty high in Somerset County, which is a deeply, deeply rural county. So there's fewer people who live there, but a greater percentage of them have trouble feeding themselves or their families appropriately, or even just enough. And so this kind of gives you an idea of what the problem is. And we're really lucky in Maine to have people who recognize the problem and are really addressing it. But I guess this would be a question for the group. And I don't know whether, Dawn, this is really up your alley, or Tony, whether this could be something you would chime in on. But who is the typical food insecure person in Maine? Or is there a typical person who does not have enough to eat?
I'm happy to take that. Tony, I don't know if you want to pong back or forth.
Sure, go for it. Yeah.
And then we can compare and contrast, I guess, and see how close we are. I would say that I don't think that there's actually a typical face to food insecurity in Maine. I think that it affects all people, all races, all ages across the board. And what we've learned even through the pandemic is there are folks that have never utilized the charitable food network before or dealt with food insecurity that didn't even realize that this was actually a thing where you could go and get help or ask for assistance. And then there are other individuals who might be seniors, for example, who are making trade-offs between medication and food. And we also see folks in the wintertime where they're making trade-offs between heating their house or food. So I think that there is no typical face. I think that it can plague anyone at any time. And there are plenty of people that live from check to check. And I think that puts people in a situation where they might need to rely on the charitable food network.
Mm-hmm.
Honey, do you agree with that, or Dr. Mamela?
I completely agree with you, Dawn. I think that there is no typical food insecure individual. And I think you said it well. Today you could feel secure, but tomorrow you may have new circumstances that you need to deal with. So I think you laid it out very well.
Mm-hmm. Mm-hmm.
Thank you.
From a more global point of view, are there any particular populations within Maine that might be more vulnerable simply because of demographic issues? So are we talking kids, elderly, indigenous people, people of color, or you're seeing it across all the demographic lines?
I would say that we're seeing it across all of the demographics, but I can share with you that BIPOC communities, Black, Indigenous, people of color, have definitely been affected more by this. And I think part of it is just access to food and access to services. And then just the fact that the pandemic has hit this particular population harder, and it's a struggling demographic. And I'm so grateful for that. I think that's one of the silver linings that has come out of the pandemic, is really started to shine a light on these particular communities so that we're able to help address their needs specifically.
Mm-hmm. I'm glad you brought up and emphasized the pandemic, because that was going to be the next question I wanted us to sort of noodle on a little bit, which is, whether the pandemic has had effects that are going to be lasting effects in terms of folks' inability to get food, to get fed.
Yeah, I mean, for the department's part, we issued, I want to say it was a little under 40 million in SNAP benefits, which is the Supplemental Nutrition Assistance Program. People used to call it food stamps, and then it was food supplement, but it's recently been adopted as SNAP, which is what the federal government calls it. We did just under 41 million in September, serving 92,000 households. And that was with, of course, because of the pandemic, we were able to apply and get approval to do maximum benefits for households. And I think when you ask about long-term effects, I do think that one positive that oddly has come out of the pandemic is it has illuminated that the standard benefits for households seem to have been a bit low. And I think that the federal government is now seeing that because of the increase in maximum benefit requests from the states, and have recently made changes to improve on that.
Mm-hmm. Interesting. I think it's probably going to be a few years before we really get a handle on all of the many insidious effects of being shut down for 2 years. Dr. Mamula, I am eager to hear from you. Can you describe how food insecurity presents in a patient, and talk a little bit about whether you screen patients for food insecurity, whether it differs depending on, the age? What does it look like in the clinic?
I think it presents itself in lots of different shadows that we don't expect. I have a little 86-year-old woman who lost her partner not long ago, so she's lonely. She has plenty of money, so it's not financial, but she's not able to drive. She's got some dementia, so she, without a lot of family support, is at home. She's lost about 20 pounds over the past year, and has not been, is fairly proud and is not asking for help. So that's one population. The other thing that happened during the pandemic is we told our little old folks to go home and not come out. So they did that. They stocked up on everything they could in March, a year and a half ago, and haven't necessarily come out. So they're getting down to the bottom of the barrel. So that was a pandemic effect.
Mm-hmm.
I don't know if there's a specific patient population that I can identify. Like Don has said, I think it's across the board, and it's an area in primary care that I think we could do better in asking. I did about 2 years ago see a patient who wasn't mine, and was a diabetic, and we couldn't, her primary care provider could not control her blood sugars. And the notes were kind of like, she's not compliant, she's not paying attention to her diet and her own quality of health, so there's not much I can do. And I happened to talk to her that day, and she admitted at that appointment that she gets most of her food from the dollar store, and she lives in a garage with no heat. So there's lots of people out there I think we could identify better.
Mm-hmm. Mm-hmm. Are there established screening programs for primary care providers to kind of get a handle on this and learn it kind of upfront?
Yeah, and I think PCHC is just on the cusp of getting that going.
Mm-hmm. Mm-hmm.
So sorry, I have a light that goes out on its own if I don't move.
Well, those are things. What health outcomes are associated with poor nutrition and with hunger?
Oh, poor health outcomes. You mean like inability to manage diabetes, coronary artery disease, COPD, I think obesity, depression, anxiety.
Mhm. Mhm.
Yeah.
And what about children? Could you talk a little bit about how children, what children need in terms of food to do well in school and to succeed
I
as
think
they grow
yeah.
up?
Yeah, I think to grow their, their brains, they need to not be sent to school hungry. I know there's breakfast programs out there. They need to not feel embarrassed and reach out for help. And I don't have a lot of it. I have
Yeah.
a largely geriatric population.
Mhm.
So I
Wow.
don't have a big sense of the pediatric population, but I do think that proper nutrition is essential to their learning.
Mhm. Mhm. Absolutely. And of course, in Maine, we're going to be talking about a geriatric population in a lot of areas of health that we talk about, right? Because we're an extremely old state. Dawn, Good Shepherd, so much to admire about Good Shepherd. It's a huge operation that provides so many people with the food they need, maybe just to get through a bad month, or maybe to help them as they go along. Could you describe your distribution network a little bit? I don't think enough people know about that.
I would love to, Kate. That's actually where the magic happens. So a majority of people, and it's my sweet spot. So yay. A majority of people, I think and I can speak even from my own personal experience, I had wanted to work at Good Shepherd for a long time before getting the opportunity to do so. And I always thought that I knew how Good Shepherd operated. People think of the food bank, and what came to my mind was that there would actually be our neighbors in need that would drive up and access food directly at the food bank, and they drive away with a car full of food and everything's good. But really, the magic of the food bank and the way that we operate is we actually rely on a partner network to distribute the food. So we don't actually provide direct service at the food bank. We have over 500 partners within our network throughout the state. And that is really that's the boots on the ground and where the magic happens. So these partners are food pantries, meal sites, shelters, school pantries, community health and hunger, like at Dr. Mamula's clinic. So there are a myriad of ways that we reach out and interact with the community through our partner network. And they are fantastic. During the pandemic, when a majority, you could see it in other states, when some food pantries were not able to sustain and remain open, we had 95% of our network remain up and running throughout the crisis, which is just a testament to their resiliency, their dedication to the work. And that's not anything that Good Shepherd can take credit for. That is definitely our network and what they do for the folks directly in their communities.
Mm-hmm.
And so, I'm sorry, go ahead.
No, you go ahead.
Well, no, I was just gonna just reiterate. So what we do is we have a fleet of, I'm looking at my notes, I got all my papers here. We've got about 8 trucks that they pick up and deliver food. We have 2 different facilities throughout the state. We have one distribution center that's located in Auburn. We have another distribution center that's located in Hamden. That helps us kind of split the state so that we're able to get more food to more people. And then the food goes out to our partner agencies, and they're the ones that serve the folks in their community.
And you said you had 500 partners. How many people did you serve last year?
Well, that's a great question. Let me look at my notes. I always get these questions. I know that we distributed about 31.3 million meals last year. And I have some other stats for you if it would kind of be interesting.
Lay them on us.
All right, so I can tell you that Maine in general, we have a population of about 1.3 million, and we rate 19th in the nation for food insecurity. So that's about 65,000 households throughout the state. And we rank second highest in the rate of food security in New England overall. And we're really only about 0.4 behind Connecticut. And those really aren't numbers to brag about. I wish that we could be on the opposite end, but Maine, again, is such a rural state. I think that the challenges are multifaceted for food insecurity here. We rank #1 in New England in terms of childhood food insecurity. There are about 20% of Maine kids that face food insecurity every year. And about 16% of our seniors also face food insecurity as well.
Wow.
Yeah.
A lot.
We estimated in 2020 about a 40 million meal gap, which means there are about 40 million more meals that were needed in order to make sure that nobody in the state of Maine went hungry for the year.
And how do we get to that number?
Well, I don't think I would like to say that Good Shepherd can come in and save the day, but I don't think that it's, first of all, I don't think that it's necessarily food access. And I'd love to hear Tony's thoughts on this too. I think that looking at different services, and Dr. Mamula as well, there's more to food insecurity than just food. I think that one of the things that I love about working at Good Shepherd, out of many things, is the fact that we look at other components to food insecurity besides food. So looking at wraparound services and other supports that can help a family not be in poverty and to meet the challenges that lie ahead of them, whether it is looking at the healthcare segment to say, what can we do to help people so that they have better health, so they don't have to go to the doctor so frequently and start to get some of these services. I know with the increases in SNAP, which have been phenomenal, and I just so grateful for what we have heard from our neighbors in need, is the increases that they've got this year have allowed them to actually go and shop like a regular person and be able to afford fresh fruits and vegetables. So they're not having to buy this pre-processed food. I think somebody on the call earlier talked about shopping at Dollar General, and when you're buying the cheapest food that you can get, it's not necessarily the most nutritious food. So trying to address all of these different facets so that not only are you ending food insecurity, but you're also it's whack-a-mole. You're trying to get a few things under control so that people can elevate themselves up. Tony, do you have any insight into that or anything you want to add onto that?
Sure. I mean, there's quite a bit there, and I do think that having more benefit to being able to purchase at the store in a more regular manner is important. I think that's also why we've been pushing our SNAP education program over the last several years, which is, I'm proud to say, recognized as one of the best in the country. And we have agents, often young college students, going out into the communities and the schools to teach about meal planning and making smart purchases with limited benefits. And so even those lessons can be carried through when you have more benefits and to work with. And then talking about wraparound services, we certainly try to, at the office, when we are able to get someone to come to us to apply for SNAP, we're looking at other potential services like TANF, which is Temporary Assistance for Needy Families, cash benefit. We're also looking at Maine Care, which is Medicaid services for people so that they can have health insurance. And we have connections throughout the department and across the state with other services like Maine State Housing and Department of Labor to help people try and get connected with employment opportunities and or housing opportunities. So it is very difficult, though, to have so many people and try to coordinate them into that wraparound service. So I appreciate you bringing up that as a concept, because I think it is an important one that we should continue to try to invest in and work on honing so that it can be improved for those that need the help.
I'm really glad you brought up the SNAP educators, Tony. I hear a lot of great things about the folks, including some young folks who are really out in the community working with people. What are some of the top things that they try to emphasize?
Yeah, Kate, I just popped, I don't know if your viewers will be able to check it out later, but I just popped a YouTube video link into the chat, and you can go kind of get a little rundown on what the sort of things are that they focus on. But for example, when they go into schools, they're bringing in, healthy snacks and getting kids excited about eating apples and broccoli and healthy vegetable type things, and getting them, introduced to new types of foods that I think can pay dividends to their long-term eating habits. And so that's one thing that they do. They also talk about meal planning, and they provide different types of recipes and help show people how to prepare and cook those recipes so that they can see that you can make nutritious and tasty meals out of beans and rice and some of the staples that over the years, people have learned to appreciate. Also, if you're like me and grew up on a lot of that stuff, you kind of get away from it as you get older. If you become a little more affluent with your situation, but it's good to revisit those things and remember that they're important parts of a nutritious diet.
Mm-hmm. I just want to pause here just for a second. Chris, can you tell folks who are watching us out in Facebook land how they can submit questions?
Yeah, so we are currently streaming on our Facebook Live. We shared it both to our general PCHC Facebook page as well as Penobscot Community Healthcare, or excuse me, Penobscot Community Health Center. So it's currently on both of those pages. So all you have to do is access that stream and type into our comment box. And I will be kind of keeping a tab on those. I've watched people kind of come in and out of our viewing, and for those that are sticking around, please type any question or feedback into that comment box, and we'll get your questions answered.
Great, thank you so much, Chris. I was going to say, one of the wonderful pieces of PCHC is our Unlimited Solutions Clubhouse, which is an organization located in Bangor, in downtown Bangor, which provides vocational training and sort of life skills navigation for folks who are looking to get back into the job market after suffering relatively severe mental illnesses or episodes of mental illness. They do a great job at Clubhouse. And one of the things that they do that's a lot of fun is that the Clubhouse members cook for each other in the kitchen located at Clubhouse. And they benefit a lot from SNAP educators who come in about every couple months and do these workshops on preparing food, on buying food in a budget smart kind of way, and understanding about portions and how to double, triple, or cut in half a recipe in order to feed the number of people you have. There is a great video about our Clubhouse cooking adventures, and it is actually, we would stream it here, but there is always sort of a lag in sound and sight when you stream videos on this particular platform. So I would just recommend that those of you who are interested in that can go to pchc.com/healthyharvest/ and you can take a look at the video, which is posted there. So here's something that people often say to me when we talk about state programs and federal programs to help folks who need a little bit of a boost. And they say, well, what do people buy with SNAP? What do they get with SNAP? And Tony, would you be able to enlighten us, or if you know, as to what some of the some of the most popular food items at the grocery store are?
Well, that's two different questions. So first is what can you buy? And it's essentially you can buy any food item that, and I can put a link into the chat to that would, lay out the different types of foods that are available now. As for what's more popular, I do think, and this ties into what Dr. Mamula was saying earlier, which is, I think it's easy for people to choose things that may not be the most nutritious or healthy, right? Because it's, some of us have had children, or I've got teen boys, and, the things that they want to eat versus what they should eat, sometimes are oppositional. So, I wouldn't be able to say definitively based on what the retailers would say is the most popular items purchased with SNAP dollars. But I can definitely say, anything that is a food item like bread and milk and cheese and vegetables and meats and fish and all of those good things can be purchased with SNAP dollars.
Well, and when you're talking about teenage boys, you're talking about gallons of gallons of milk and entire loaves of bread gone in a nanosecond. So definitely, yeah, that can be challenging. Seriously.
Yes, absolutely.
So I recognize that none of you, at least as far as I know, are registered dietitians. But I'm going to throw this question out. If well, I have two questions. One is, if you have $50 to spend on food this week, where do you get the most bang for your buck? And the second question that I'd like you to consider is, how can the people who are watching, how can individuals make a difference? How can they help their neighbors? And I bet Dawn wants to jump on that one right away, so we can flip the order of the questions if you want to do that.
That's okay. I can't answer that. I think that you can help your neighbors in need in a lot of ways. One of the things we were talking about earlier that I thought was interesting, I think it was Dr. Mamula had mentioned about some stigma about sort of being proud and afraid to ask for help. Sometimes you just might not even know that your neighbors are struggling with food insecurity because it's just something that they don't want to admit. And I think that in Maine, because we have such a rural population, I know that we've heard time and time again where people are actually a little insecure about going to a food pantry themselves or reaching out for help because they think that somebody from the town is going to recognize them or that they're going to just make their needs known. So I just think just asking folks, hey, how's things going? Do you need any help? I know that usually that's helpful. You can also donate. I think donating to your local pantry is one of the best ways to help. Most of them have Facebook pages or they have social websites where you can go there and see what they're asking for as far as food items are concerned. Dairy is always popular, paper items, non-food goods as well. So even when we talk about food insecurity, there's other things that might help a family, like diapers or formula, things like that, that just you wouldn't think of when you're faced with food insecurity. Volunteering at your local pantry, absolutely fantastic. We always encourage that. Volunteers, what most people I don't think know, at least I didn't before starting at Good Shepherd, is that food pantries, meal sites, and soup kitchens, most of them are powered on volunteer power. And these are folks that are retired, they're in it to make a difference and to contribute, but that it can be heavy and busy work. And so always finding folks that are energized about it and ready to step in and help, and new faces are always welcome at a food pantry. So I think that those are some great ways. And money, I don't think is ever looked down upon wherever you want to give it. So again, donating to your local food pantries, and that's wonderful. And also donating to Good Shepherd. I just am hesitant to say that here because I don't want to turn this into a sales pitch by any way, shape, or form, but I can share with you like, you know, $1 can go a long way. That provides 3 meals for somebody
Oh,
through what we can do at Good Shepherd Food Bank. And I'm sure that our partner agencies have the same ability to work the same magic with the money that they get and how they're able to use that as well.
that is a really astounding figure. I love that. That's just, you know, really you can triple the power of $1.
You
Um,
can.
Amazing.
It's
Amazing.
absolutely amazing. So I always think about, well, if I donate $365, I'm actually buying somebody 3 meals a day for a year. And it's just that you don't even think about when you think about your buying power at the grocery store. And I think that was our next question is if you have $50, well, what would you buy? And I've taken up a lot of time by talking, so I'm going to let somebody else answer that question first.
Dr. Mamula, would you like to take a stab at that?
Can you ask me the question again?
If somebody has $50 to spend to feed themselves or their family for this week, how should they spend that money? I mean, obviously you can't tell people, you know, what their preferences should be, but are there certain food items that are really important in terms of nutrition, and how do you find them?
I actually think our grocery stores do a fairly good job identifying sales. You can get fresh produce and vegetables if you're careful in looking for the sales in the produce section. Same with the price of chicken. You can get a like a 5 or 6 pound packet of chicken breasts for, you know, I think I just got one for $4 or $5, and that can feed a family for quite some time. So if you're careful in looking at prices, you can actually find some pretty healthy produce right at our local grocery stores.
Mm-hmm. And I noticed over the last couple of years that more and more farmers markets are accepting SNAP benefits. Tony, could you touch on that program a little bit? I think that that's something that a lot of people don't know, but it seems pretty cool.
Yeah, I think at the last count, we have about 50 farmers markets signed up to allow for EBT purchases. Maine recently was awarded a grant to help with the cost of getting point of sale machines at farmers markets. And we have seen an increase in activity at farmers markets since the pandemic. I think shopping, you know, in many of the outdoor or spaced out locations certainly is makes people feel a little more comfortable when they're out shopping. And I did want to tail on to what Dawn was talking about earlier about the stigma of going to food pantries. I also think that, you know, what we can do as other people in the grocery store is, and this has, I've seen this myself, and I know there's a lot of anecdotes out there, but you know, the person that's in front of you using the SNAP EBT card for the first time, you know, sometimes the cashier or whatnot will have to help them. And you just know that it's hard for that person to go through the experience of learning how to use those benefits. So if you ever find yourself behind one of those individuals, I think if you can just be kind and understanding, I think that goes a long way towards making people feel a little bit more comfortable about the fact that they're going through tough times and they're learning how to, you know, survive. So I would just add that. Thank you.
I would completely chime in on that. I thank you so much for bringing that up. We've heard from neighbors in need that there is a stigma associated with that too, and almost an embarrassment for having to use that. And it's almost like it's somebody's fault that they're in the position that they're in. And I think that there is more that goes into that than just being judgmental. And I think that offering kindness and being the change that you want to see in the world can make such a great difference. And just offering that bit of support. So thank you. That's a great point.
From what I have seen, it is easier to identify people who are hungry and need help, and harder to get them to reach out and agree to ask for help. So often in primary care, we know the people who are hungry and struggling, and they are not willing to allow us to help them. So I think that stigma tags on to what you both are saying.
Dr. Mamula, what are some of the ways that you as providers can actually offer that help? If somebody comes to you and they are, you have identified them as perhaps hungry or food insecure or just making it, what kind of help can you offer them?
We have a multifaceted approach. We can direct them to food pantries. We also have social workers in each one of our clinics, so we try to direct them to our social worker to identify other ways that we can help. Sorry, I'm getting tired. Let's see, what was the other thing I was going to say? I had something great. It's gone.
Oh, it's the end of a long day for a lot of people.
Yes.
I would imagine for a medical provider, it is really the end of a long day.
Yes.
Well, go ahead.
Oh, I wish I could remember it. The food pantries. It's gone.
Well, tell you what, we'll circle back in case you come across that thought again. But Chris has let me know that we have a question or two in the chat. Chris?
Yeah, we had a question that was submitted. The question, and it might kind of speak to a broader point, but the question asks, is there any legislation going on right now dealing with food insecurity in Maine? So I guess to kind of like encapsulate that question is kind of asking the group what's kind of the government response to food insecurity, or obviously we've got SNAP, but is there other things that maybe we haven't touched on, or other government legislation that help fight hunger in this state?
Well, I mean, I would just say I just was actually looking at some recent legislative submissions that are being looked at for the upcoming short session. I didn't see anything particular to that, but I would just echo that. And I think if we get back to the wraparound services idea, you can't buy everything with SNAP and food benefits. And as Dawn pointed out, and as Dr. Mamula has pointed out, there's other things that are essential to someone's health. And so if they're applying through our office, whether it's online or coming into an office or just calling us, we can take applications over the phone right now during the pandemic. We can also screen to see if somebody's eligible for Maine Care and get folks medical insurance so they can maybe attend to some health concerns maybe that they have, and they can get SNAP benefits to help them eat better. And maybe they might be potentially eligible for some cash assistance depending on their family situation. And that would help them buy other things that go into helping them have that holistic approach to improving their lives.
Yeah, absolutely. And of course, we just saw in the referenda that the state of Maine voted on the other day, there was an item that would create ultimately a state constitutional amendment that recognized the right to food. This is something that many farmers were very much behind. And I guess I would love to throw it to this group, whether you think, and that was a complicated and political debate that was held around that. And there are a lot of tentacles to that debate. But I guess I would throw it to this group. and especially talking about stigma, why is it so difficult for humans to kind of recognize that everybody has a right to have food? And why, you know, if we think about that, is that something that could reduce stigma for, you know, having SNAP benefits or going to the food pantry? If we simply recognize that everybody needs to have food, and sometimes people don't have enough. Is that something, does that make any sense?
It does. I'll try to bite that off because I think that is the right question. I just don't think that we have enough time in this particular session to tear that question apart and really answer it, to be quite honest with you. There's been some extensive work done in that particular arena, especially by this lady. Her name is Dr. Donna Beagle. And one of the things that she references in her work is that we look at people in this country, in America specifically, as it is their fault for being poor, instead of looking at other situational issues that might have put them in that particular way, or what we can do to help folks out. And I know, speaking about stigma, just going back to one of the things that Tony said about using the SNAP benefit, I can't tell you how many folks are working 1 or 2 jobs to support their family, and it's still just not enough to make ends meet. So it's not, when you think of folks who are experiencing food insecurity, that people are lazy or they're not working, or that people that are utilizing the benefit network, that they're not doing what they need to be doing. As we started out in the beginning of this call, there are folks that can be in jeopardy because their situation changed. You have medical issues that are expensive and you don't have health insurance, or your job moved or it got canceled or you lost it for whatever reason. Those things can put anybody in jeopardy of facing not only food insecurity, but needing to reach out and reach out for benefits and get those other things. So I think understanding that everybody has food, that's just one piece of it, but I'm not sure how you get folks to do that in the moment and change that view universally. I think if we did, it would be a utopian society. It would be great, because then I think that some of these challenges that we face, I just don't think would be relevant.
Right. Well, we'll have to get a team of sociologists on our next community forum.
I will tune in for that, Kate. I think it would be
Have them solve a few of these problems for us. I wanted to point out that Chris has put, Tony is a machine here putting up some incredible resources in our Zoom chat, and Chris is putting, there's another one, Chris is putting these in the Facebook chat so they're accessible to our entire audience on Facebook. I would ask, the hour draws late, and so if anybody out there has another question, please submit it now in the comment box on Facebook, and Chris will field it and get it over to the right person. I guess kind of thinking in conclusion here, I'm wondering if each of you could tell me if there's one thing if you were the king or queen of the great state of Maine, and you could impose one thing to kind of attack this problem, to attack what is indeed a social determinant of health, right? Is nutrition, hunger. What would it be? Dr. Mamula?
I think it would be breaking down the stigma and the shame around asking for help, and then also the willingness to help your neighbors and check in. And there's plenty of food in this state. There's a lot of waste. There's lots of opportunities. We just need to identify who they are and be willing to be a kind neighbor.
It might be as simple as walking over to your elderly neighbor and say, I made way too many blueberry muffins, or I bought way too many chicken thighs. Will you take them off my hands? Right?
Yeah.
Yeah. Let them do you a favor by taking the chicken thighs out of your kitchen. Right. Exactly.
Right.
How about you, Dawn?
So narrowing it down to one is tough. I love Dr. Mamula's view. I would try to do what we're doing right now, is connect all of these services so that there's a greater network of support, but make it so that we all kind of know what we're doing. So as Dr. Mamula's team is recommending folks to food pantries, and food pantries are directing folks to get SNAP benefits or sign up for Medicaid or Medicare or other types of insurance programs, just make sure that that support net is widened, and somehow increase the communication between these services so that people, no matter where they turn to for help, it's a wide net of support, and they don't have to worry about if they go here or they go there, that they're going to get treated poorly, and or make it so that they only have to go to one place and all of those services are available, so they don't have to visit 5 or 6 different destinations in order to get multiple points of help.
Mhm. Right. So what you're saying is that we really need to have a little bit of a more solid cooperative fabric between healthcare providers, social service agencies, organizations like Good Shepherd, the state government, administrators of programs that can help people. It's interesting. I don't think we necessarily have that. You know, there are some really well-informed people in all of those organizations, but we don't have, you know, monthly meetings. I mean,
right.
that could be a little bit of a drag, but we
Indeed, right? So I mean, if I were queen of Maine, I guess that would be the one thing that I would try to implement. But I think that there are organizations to do that right now. And to one of the questions that Christopher had asked earlier, is there any legislation around ending hunger? There is a legislation. I'll actually put it in the chat here in a moment, but the Maine government is working to resolve to end hunger by 2030. And over the course of the summer, there were a lot of community-based organizations that met, including the DACF, Maine.gov, SNAP educators, and also the most important piece, which are people with lived experience, so that we understand what it's like from their perspective, to try to come together and see what are the ways that we can connect and strengthen this network so that we can work to solve that by 2030. So I think that the work is already in progress. It's a large piece of work.
It really is, absolutely, and a good timeline, a good long timeline for a runway. I'm going to ask Anthony to chime in on this question really quickly, and then Chris tells me we have yet another question in the chat. So Tony?
Well, I'm going to assume that we're all equally with regal authority, and I'm not going to build off what they already said. I'm going to throw a wild card out there, because I've been thinking a lot about it recently from some conversations with my mom. I'm going to go with food education, just general decision-making on what to select and what to cook, how to cook it and prepare it. I think SNAP education is really important, especially gardening. My mom does gardening every year, and she learned it from her mom, who learned it from her mom. And if you go way back many years, gardens were a big part of families, and canning and salting and drying goods. So I think that's kind of a lost skill that I think would be helpful for a lot of people to become a little more proficient with these days. So that's my wild card for you, Kate.
That is a great one. It makes me wish I had somebody from Cooperative Extension here who could tell us how we could go about doing that, implementing that. That's cool. Chris,
and with SNAP, you can buy seedlings and stuff, so you can then go. You know,
wow.
Yeah,
so that's very cool. I did not know that. You know, you can plant your garden with some SNAP benefits and then reap the benefits for weeks and weeks, really. Chris, there's one more question in the chat.
Yeah. And it's, I think it's a really nice one to end on, because, you know, we've spoken to a lot of our leaders in our community that, you know, tackle this challenge day in, day out. But the person that submitted this question identified it's broad, but I think it kind of changes the perspective a little bit. The question asks, you know, what can we do, we being the community members that might be viewing, or just anyone in general, do on an everyday basis to help fight this? What are some things that people can do to get involved?
I think that's a good one. We did touch a little bit on some of the ways you can help our local food pantries and how you can practice kindness to start erasing stigma. Is there anything, if any of you could suggest one thing, one new habit for people to pick up as we go into the winter here to end hunger, what would that habit be?
I'm going to pop in with two because Tony just sparked my interest in gardening. I think that in the summertime, at least you could grow some extra vegetables and take them to your local food pantry. I think that that's always appreciated. So thank you, Tony, for that. I also know usually around this time of year, it's the giving season. So most supermarkets have, I know like Shaw's does turkey bucks where they'll donate those to their local food agencies. Also Hannaford will have gift cards that you can purchase that those donations will go to your local food pantry. I think that and actually going out and volunteering. And I think volunteering, not just in the winter time when folks need it and it's top of mind, but get out there in June, July, and August when it's really, people kind of forget about it until December rolls around. Mm-hmm. And experience what that's like just to give back to the community. I think that it's a really rewarding situation.
Absolutely. Tony, Megan, do you have anything to add to that?
Maybe just learning that it's okay to ask, are you okay?
Yeah, a similar theme, but I would highly recommend if you have a family member or a friend or a neighbor that needs some help, maybe you could help them with, getting to the place where they can apply for benefits or getting some help that they need. Sometimes that's all you need is somebody else to give you an encouraging word to help get you to the next step.
Ask volunteering to take them to the grocery store if they're geriatric and don't have a car is a huge assistance. Teaching them to order online and picking up their groceries for them is another. When you go, when we go to Hannaford, it's easy to pick up somebody else's order and deliver it. There's lots of opportunities out there. I think those are two other areas that we could help at least our geriatric crew.
Mm-hmm.
Yeah, that's a great point. And I think we've all learned from being in the pandemic. Many of us have probably had to deliver groceries or supplies to family members or friends who've had to deal with, having to be isolated for a period of time or not. So.
That's right. Well, I'm hearing a wonderful common thread here, and it reminds me of what my mother used to say, which was, if you can be anything, be kind. And I think that is a really good answer and may go a long way to helping us address the problem of hunger in our beautiful state. So we have hit the 6:59 number almost exactly. I'd like to thank everybody who joined us on Facebook, and I'd love to thank this wonderful panel for really bringing some interesting, smart points forward here and educating us a little bit on not only what the situation is as they see it from their unique perches, but what we can do as individuals and as members of the community to address it. So I'd like to thank everybody again. Thanks so much. And one last question before we go. If folks out there have a specific question for any of you, are they able to reach out to you via email, or is that something that you would welcome, or is there another forum that you would like to meet people in?
I put my email in the chat, and
Okay.
I'm fine with that, of course.
Okay. All right. Well, thank you all so much, and I hope to see you all again soon.
Thank you.